The findings of the study on mental health that was done by Mbale Regional Hospital were reviewed to the district's health authorities, school heads and political leaders in a meeting held in Mbale City as part of activities organized to commemorate the Mental Health Week. In the study, it was found that 22% of the young people and youths in the Elgon region aged 7 to 18 are engaging in various forms of drug abuse.
The dominant cause of the mental illness, more especially in the youth, is alcohol and substance use. Okay? We have a number of alcohols now which are very cheap, available and affordable on the market, and packed in the way that an individual can walk with them in their pockets.
With the increasing rate of drug abuse, many young people and their youths have been exposed to mental illness, especially depression. A number of reasons have been advanced for the increasing mental illness among young people.
But also neglect of the family, of the children by their parents. There's a lot of separation. Some of the parents at the children are telling you, my mother went for cheyo out of the country or went to Arab countries. And now the child is left alone at home and not with the relatives who are not caring about them. So this child is going through depression.
The hospital also reported increased cases of retirees presenting with mental illness as a result of delayed payment of retirement benefits.
We are receiving a number of our colleagues who are retiring from service, and they are not easily coping up with the external stressors outside in the communities. So as they get out, maybe because of the inappropriate use of their packages, they end up really having a lot of distresses and they're getting a lot of depression.
Whereas the number of mental illness patients is on the rise, Masaba points out that the hospital does not have enough health workers to provide the much-needed health services.
But also the numbers of the health professionals, the mental health professionals, is also low. For instance, on the establishment, you're supposed to have 7 clinic officers. At the moment, you have only 3 in the unit. We run a coverage of 17 districts and 1 city.
The officials now want government to increase its funding towards mental health in order to improve on access to health services for people with mental illness.
But when we are planning and programming for diseases in our environments, I believe education and health work together on most of these things. We barely plan for mental illnesses. We are planning for HIV, we are planning for malaria, we are planning for the radio diseases, and we barely think about mental illness. That's why we are having a prevalence of mental illness.